Hey everybody, welcome to Everybody Can Have One More Cat with Stephen Meserve, because no one will ever notice. Hey everybody, I'm back finally after like a 6 or 7 week break with Everyone Can Have One More Cat. I am joined today by Dr. Paulo Rivera from South Florida, from West Palm Beach, right?
Correct.
West Palm Beach?
West Palm Beach.
West Palm Beach. So your whole life you lived there?
No, so I grew up in Puerto Rico actually, and
Ah,
moved
nice.
to this. Yeah, I moved to the States when I was 23 for vet school.
Oh wow, amazing.
Yeah,
Okay, cool.
yeah.
And you went to vet school in Florida, or what?
No, I
Oh,
actually went to Ohio
is there a
State.
vet? There's not even a vet. Is there a vet school in
There's
Florida?
one, yeah, in
There's one.
Gainesville,
Yeah,
Florida.
yeah.
Yeah, but I actually ended up in Ohio State, and then slowly but surely, after I graduated, I've been moving southeast. Did an internship in Virginia, and then a second internship in North Carolina, and then I did my 3 year residency at UF, and that's how I
Yes, at
kind of
least you're
ended
coming
up
back
here.
to your weather that you were used to. Ohio must have been tough for you in the winter, no? I
Oh
mean,
yeah, yeah. It was fun for a little bit when it snowed and for like,
yeah,
a
it's
couple
nice at first,
days and
right?
yeah. And then the snow starts to melt and it just gets mushy
Yeah,
and
it gets
cold
messy
and I
and
don't
dirty.
yeah.
I did a
Yeah.
little bit of I did a small stint of living in Columbus, Ohio. So,
Oh,
but
cool.
I'm from Boston originally, so the snow doesn't really affect me.
I actually
Funny
liked
enough,
it there a lot.
yeah, funny enough about Puerto Rico that we have our first club forming in Puerto Rico as well. So we'll start to see Love and Cats shows coming up in Puerto Rico in the next
Oh,
within the next
awesome.
year. So yeah, so we're excited about it. I'm really looking forward to it. So everyone's listening. So Dr. Paulo and I are getting together because you know that we are at Loving Cats talk about a lot about health, the history, and there's not a lot of information out there for you guys that if you want to add a pedigree cat to your life, that's your priority.
Hmm.
But we always say get another cat, get another rescue. That should be another good way to do it. But there's not a lot of information, and everybody, I wouldn't say everybody makes a mistake at first, but this conversation that I'm going to have with Dr. Paulo is going to hopefully help some of you understand the importance of why I talk about health screening. We're going to talk a little bit in detail about this specific heart disease called HCM, and I'm going to let you, Dr. Paulo, say what the real word is, but
Yeah.
we're going to talk about that a little bit. And there are a lot of diseases that are breed specific, and it doesn't mean if you have a non-pedigree cat they're immune to it either. I mean, they can absolutely go into
Correct.
it. So tell us about your role at CVCA and like what exactly that is. Yeah.
Yeah, I'm a veterinary cardiologist, meaning that I'm a veterinarian. So I went through vet school, but then I did some additional training of typically 4 additional years of training after vet school, where you go into specialty training. And for me, right, I did a cardiology residency at University of Florida at their small animal hospital. And then when we train, and then we take our boards, and then I finished my training and became a cardiologist 2 years ago.
Ah,
And
so
since then, I've been working. Yes, and I've been working at in West Palm Beach with CVCA as the cardiologist with them there. But CVCA, we're kind of a big cardiology or veterinary cardiology practice where we have clinics, all over the United States, and we kind of work within specialty hospitals
hmm
to provide our services there.
So it's a very specific. It's you don't hear a lot, or I'd say we don't hear that. I do because of the world that I work in. But I think a lot of people just think, oh,
Right.
that's a vet, But this is a very specific area of practice.
Hmm. Hmm.
And so how we're getting together is that you are going to be present at the West Palm Beach Cat Extravaganza, which is coming up in November 1st, and
Correct.
you can let us know what's going to happen there and how that's going to help the general public, right?
Yeah, definitely. So I'll be offering echocardiogram, I guess echocardiograms for cats at a low cost at the Cat Extravaganza event, and basically to screen for hypertrophic cardiomyopathy or what you call
That's the
H
word. Yeah.
HCM for short, which is what most people most of us call it. And HCM unfortunately is a very common heart condition in cats. It's the most common heart condition I see in cats by far, and 1 in 7 cats, or about 15% of all cats, have HCM.
In general,
And
pedigree
yeah,
along.
in the general population of cats. And what's kind of concerning that is that it's silent. A lot of the times they don't have heart murmur, they don't have any abnormal, auscultation findings when we listen with our stethoscope, and they don't show any symptoms until it's really advanced, until they have congestive heart failure or saddle thrombus, which we can talk about that, which are, they're very, very consequential and sad complications that can happen.
And I mean, obviously there's breed specific things, but it can pop up anywhere for the most part. I mean, what I say, I'm not a veterinarian by far, but what I do say is that, the breeders that are doing the proper breeding, which when we're breeding cats or breeding dogs or horses or anything, the idea is to make sure the next generation is better than the first, and we're screening, right, to potentially decrease. We've done better jobs. I'd say better jobs. There's more
Yeah,
advanced
yeah.
in cats and like PKD and things like this, and you can scan this and
Mm-hmm.
get rid of it. And a lot of these other congenital diseases, all right,
Yeah. Well, I guess genetic, because they're
yeah.
not quite born with it. They get it as they get older. So there's a genetic component, but it's technically what we call an acquired disease. So you
HCM
can
in general, yeah.
HCM. Yeah. So for example, you can screen a cat at a year of age with an echocardiogram, and they can be normal. But you still have to keep up with that, and you still have to screen them yearly because they can get it at any time. Typically middle-aged is kind of where
Yeah,
when they get it.
what's so frustrating, I guess, about
Yeah.
this disease in cats, right? Is that the breeders of very specific breeds have to be even more diligent. Obviously,
Yeah.
Maine
Hmm.
Coons, British Shorthairs. Sphinx have actually made a pretty good run at what they're doing
Right.
with HCM.
Hmm.
From what I understand, the Sphinx breed has made some very very strong advancements. Do you know about that? Yeah, or can you
Yeah.
say?
Well, as far as the genetic testing goes,
Mm.
yeah. So we've been making advancements with certain breeds. We've made a lot of progress, and we've identified genetic markers in the Sphinx cats, as well as the Maine Coons and the Ragdolls, and
Which are literally the three biggest problems,
yeah.
I suppose, and the British, I guess, right?
Hmm. Yeah, exactly. So we found genetic markers in those cats that we can, help uh, identify, whether these cats are, whether they have copies of the mutated gene that can cause HCM, and basically, it'll tell us whether or not they are, at some risk or at higher risk. The caveat is that even if those cats are negative, they can still get HCM. So that's why genetic testing is tricky, because you can genetically test the cats, and if they're positive for the gene, yeah, they're going to be at some risk or high risk for developing HCM. But if they're negative, they can still get it, because that's only one gene that we've identified. There's probably hundreds of genes that we don't that we don't know can cause HCM,
Yeah.
or other mutations that can happen that can lead to HCM. But those are the typical ones that we've identified in those specific breeds.
Yeah, it's kind of like for you guys that are listening, like the breast cancer gene, like do you risk it or do you not risk it? You know what I mean? Like
Right, exactly.
similar thing, right?
Yeah.
But so why is it critical, and like are we recommend, I mean, obviously this is your area of forte, right? This is your area of focus,
Yeah.
and is it necessary for the general public to be scanning? Like, and should they be scanning? And what happens if they do test to a level that's not great, I guess?
Right. Yeah. So that's, you mean scanning with echocardiograms
Yeah, yeah, yeah,
or
yeah.
with
In,
genetic
in
testing?
general, like, so if I had a rescue cat, like, you know what I
Oh,
mean,
right.
from, like, let's just say, like, should I be scanning that cat, or I mean,
Yeah, no, that's a great question, Stephen, because yes, scanning is the gold standard, right, to identify HCM, but it's also very expensive, right? So
indeed, and,
we,
yearly, right? I mean,
yeah, exactly. So it can become very expensive to do that. So there are other tests that can be done, as far as screening goes, to hopefully detect the disease early on in the process. So, for example, right? Well, the first thing is first of all, taking your cat to the veterinarian, once a year, so they can get a listen with their stethoscope
yeah,
for abnormal.
that's the first step, right? Because,
Yeah,
like,
right.
the general population, the
Yeah,
average vet visit for a cat is a lot lower than a dog,
right.
you know?
Exactly. Yeah. So that would be the first step, right? Getting your cat to the vet for their wellness yearly, and they'll listen for any abnormal findings like a heart murmur, which typically indicates turbulence or uneven blood flow, which HCM can do that. But you can also have benign murmurs, things like that, which is another story. But the other thing that the general population, your typical the cat owners can do is going to be, their yearly labs. There's one test called the Pro BNP. I don't know if you're familiar with that one. So the BNP is it's a relatively new test. Well, probably not new in the last 5-10 years, but yeah. So where we test for an enzyme called BNP, which is an enzyme released by the heart whenever there's heart stretch or heart muscle stretch, and when you have a cat with HCM, that obviously causes stretch of the atria, which are the top chambers of the heart, and that BNP gets released into the bloodstream, and we can test for that. Um, so that's more and more become part of the yearly blood work that is done. And my personal and professional opinion is that every adult cat should have a yearly BNP as part of their lab work, because that's one step that can be taken to say, hey, you have this abnormal marker in the blood work.
To watch for, yeah.
Yeah, exactly. Yeah.
I mean,
And then, at that point, if they have an abnormal BNP, then we can say, hey, let's refer you to a cardiologist and let's get that echocardiogram done.
exactly. So I guess explain to our listeners or viewers at this point, what exactly is HCM, and like I mean, and the effect it has on the cat, and I mean, it's the prognosis, you know what I mean, which is not
Yeah.
amazing. Yeah.
Yeah. So HCM, or hypertrophic cardiomyopathy, is a condition of the heart muscle, and hypertrophic means that it gets thick, right? And it grows abnormally. And a cardiomyopathy is a condition of the heart, or the heart muscle specifically. So hypertrophic cardiomyopathy, or HCM, is when the heart muscle of the cat, mainly the pumping chambers or the ventricle, starts to become really thick because it grows abnormally, and it becomes stiff, right? Because the heart not only pumps, it needs to relax in order for it to fill with blood and then pump.
Mm.
And when you have a abnormally thickened heart muscle, the heart cannot, cannot relax very well, right? So what happens from that is that the pressures start to back up upstream because blood is not flowing forward effectively. So you have a buildup of pressure upstream. You get enlargement of the atria, which is the top chambers of the heart. And just like us, they have four chambers, so it's all very similar, anatomy. And what happens is the pressure in the heart builds up, and then those pressures back up towards the lungs, and then they start to get fluid leakage into the lungs, which can lead to, and that's what we call congestive heart failure, when you have buildup of fluid in the lungs, and
Humans, right? I mean, isn't
right, yeah, yeah. You have fluid buildup, and
it?
that is devastating because they start to have trouble breathing, and then they need to be right. You need some sort of intervention to get them stable, and that's one of the complications that could happen with HCM. The other complication that could happen is when they have enlargement of the atria or the top chamber of the heart, the blood flow becomes very stagnant, and they can form blood clots in there, and those blood clots can dislodge from the heart and then go to the body. Typically, the back legs is the most common place where they'll go, and that is a very devastating and painful complication. That's what we call the saddle thrombus, where they become paralyzed, right? And the back legs, they start to drag their hind limbs, and it's very, very painful. And that's an emergency. And it's very sad when we see those, because sometimes that's the very first sign that they,
Right?
yeah, yeah,
They're having problems in walking,
exactly. And
and
they're a completely normal cat one day, and then all of a sudden they have this life-threatening complication. And then lastly, the third complication that could happen with HCM is they can pass away suddenly, so that's why it's so important to kind of be in the forefront of identifying these things early.
so if let's briefly, I mean, obviously you are there for all cats as we are, right? So whether you're a Maine
Yeah.
Coon, whether you're a domestic cat, it's fine. But
Yeah.
if someone that's watching, listening, wants to add a Maine Coon to their life, right?
Hmm.
You and I both have Cavaliers, dogs too, and I
Yeah.
assume you have Cavaliers for this
I have a
breed.
cat too. Yeah.
And yeah, but you have a Cavalier for the. I
Right.
mean, they're the most cat-like dogs in the world. Let's be
Yeah.
honest. You know what I mean?
Yeah.
Like, but this is a specialty of yours, and as most of everyone knows, Cavaliers also do have their own heart issues,
Yeah.
right?
Yeah.
Which
Correct.
is interesting that you have one. I have two.
Yeah.
So,
Yeah.
but if you soon to be three actually, if you
Oh man.
have yeah, if you have
You
well,
can't just have one. You
well,
cannot just have one.
we work with a really reputable breeder here in Portugal, and like
Okay.
we're like the holding pat. We hold the females for some of them, which is nice.
Okay. Right. Right.
Yeah.
Right.
But I don't do anything with the dogs. I can't be breeding, delivering
Right.
puppies. I don't do that. So anyway, so I guess like the most common question is, I mean, for the general public, I want to add a Maine Coon to my life, and for you to speak to the breeders as well, I mean, I always say, if you want a Maine Coon or a British Shorthair or any cat, any pedigree cat, you should ask for the proper documentation of
Right.
screening. But like, at what age? Like, it's so hard, right? Like, you know what I mean? A female Maine Coon, like, you don't want to let cycle for 3 years, you know what I mean?
Right. Right. Right.
Because that has another whole issue of problems. So
Right.
it's very different than dogs, like a Cavalier can probably hang on to 3 years or 4 years before you breed it, but a female cat risks a lot of other problems. So I
Right.
guess, like, in your opinion, like, what should they be asking, like, and what should the breeders actually be doing proper? I mean,
Hmm.
do you know what I mean?
Yeah. Yeah. So yeah, you have two different viewpoints, right?
Yeah.
The viewpoint of the breeder and the viewpoint of the person who's gonna get the cat. And from the breeder standpoint, it can be very tricky, right? Because right, they're bred early on, and they may not have the heart condition until after they're done with their breeding.
Exactly.
So even if you screen them yearly with echoes, they can still get HCM at some point in their lives. So that's why it's important to have a more like multimodal approach. So the first things first, right? If you're a breeder that works with Sphinx cats or Maine Coons or Ragdolls, right? The
Bengals
first
too, I guess, but too now.
Bengals,
Bengals, yeah, to an extent.
for a genetic test for Bengals or.
No, for HCM, you see.
Oh yeah. They are definitely predisposed.
Yeah.
But at least for the cats that we know we can genetically test, certainly that's the first thing to do, right? Genetically testing those cats,
And that's as easy.
and
That's as easy. Is that as easy as a swab and sent in? Like
you can do
there's
swabs.
literally no reason that a Maine Coon
Yeah.
breeder, British breeder, or anyone shouldn't be swabbing their cats, right?
Yeah, you can do swab. You can do a little whisker.
And send
Um,
it right into UC Davis
yeah,
or
correct.
wherever,
And
right? I mean, but
NC State, UC Davis, and
so that genetic marker can be used on Sphinx, Ragdoll, and Maine Coon right now.
right. So it's three. It's different. They're all different,
Yeah.
and they're specific for each breed. But and yeah, so you can send one out for Sphinx. You can send one out for the Maine Coons, and then you can send one out for the Ragdolls as well. Yeah.
Those three right now so far.
Right.
So that's like there's no reason for not to be able to ask for that from someone that would like a Maine Coon, but you have to prepare yourself if you want to get one of these breeds. That does not, you're saying it does not say that it's not a guarantee. It's a step forward, right? And if you're going to develop HCM, is there like a time where it's like, you're kind of like in the clear? You know what I mean? Like, or is that like a too definitive question to ask? Like if I have a 6, and he's still scanning clear and doesn't have the genetic marker, like
They can still get it.
and,
Yeah, it can develop at any stage in life, unfortunately. But I would say on average, it's like for non-purebred cats, on average, I would say you start seeing it at like 5 years of age. But I mean, I've seen, cats get HCM at 1 or 2 years of age, So
and unfortunately, the breeders and some breeders, like the best ones in the world need to prepare their kitten owners or new families for these situations, and people that are, and I'm not saying anything, like Maine Coons are wonderful animals, British are wonderful animals, Ragdolls are wonderful animals, you know what I mean? Like there's a risk of everything. The adopt don't shop mentality, that kind of thing, where we should like you can still get it in a non-pedigree. You know what I mean? Like that's the issue, and people are attracted to pedigree animals for a specific reason. Everyone Can Have One More Cat with Stephen Meserve is brought to you by Roz, a family brand with a big heart. Roz is a pet nutrition brand that understands the importance of helping the furry friends we all consider family. Not only are they committed to providing pets with natural food options that are high meat and minimally processed, but they are also dedicated to giving back to those in need. By donating 100% of their profit through the Roz Fund, they've contributed over $3.7 million to pet-specific causes and those living with disabilities across the United States. Cooked in small batches, without the use of rendered meals, Roz Recipes ensures high-quality protein and nutrition in every bite. To shop their line of nutritionally complete offerings for cats and dogs, or find an authorized local retail partner near you, visit rawsnaturalpetfood.com. That's Raws, Rawz. Right? I mean,
Yeah,
like,
exactly.
there is,
They like certain, qualities that they have, and that's
and that's
fine,
fair. And that's their what they choose. No
Yeah,
big deal.
yeah. I
Um,
mean, I love Maine Coons. They're great cats.
yeah.
Um, and obviously I have a Cavalier King Charles.
Yeah,
So
which is like one of the most. I mean, gosh, poor Cavaliers are getting banned in Europe. You know what I mean? So it's
oh my
like,
God, yeah,
you
yeah.
know, and it's in the my calves. I told you are still scanning clear, which is really good. But it is what it is. And
Hmm.
you can only do we can only do your best. So those
Yeah.
are really so if I was gonna go into the Maine Coon market, right, and I wanted to buy a Maine Coon, and someone said, well, we do an we do an HCM scan, but we didn't do a genetic marker, like that's kind of a red flag, no? I mean,
Yeah, it's tricky, yeah, because technically the gold standard is the echocardiogram. Um, so I think they're not like one or the other. You should ideally have both
both.
because
And the first
um,
one can't be that. I mean, the second, the full EKG is expensive, right? Like
right, the echo,
it's
yeah.
not expensive, but I mean, it's more expensive than the swab, right? I mean,
Yeah, for sure. Yeah, for
sure.
sure.
So
Because the genetic testing tells you the risk, right? It doesn't tell you whether or not the cat actually has it. It tells you the risk of the cat getting HCM in the future, and then the echo tells you whether or not it actually has it. The echocardiogram. So there are different tests, right? Um, so to get
and
to your question,
there's
yeah.
different levels, right? Like you when you scan a Maine Coon or a cat in general,
Mhm.
like can you speak to, like, I'm assuming you can tell how severe it is,
Yeah.
right? Yeah, I
Hmm.
mean, how severe it is and how likely it's a very bad outcome. But what happens if it's like slight or like mild, or like is that a case? Does that happen? Like, you know what I mean?
Yeah.
Because I mean, a cat can have a murmur, a human can have a murmur, right? I mean, like
Yeah.
nothing's ever gonna materialize, right? I guess.
Yeah, well, it depends on the cause of the murmur because a heart murmur in itself is not a diagnosis, it's a
Right.
physical exam finding.
Something wrong with it ish.
Right, exactly. And you can have benign heart murmurs where you have a heart murmur, but there's nothing wrong with your heart. It's just like you're just, a little different. So as far as the lost my train of
The
thought here.
levels, like
Yeah.
how
Oh,
bad,
yes.
yeah, how
Yeah,
bad
so
actually, what's the outcome, you know?
we actually have a staging system
Yeah.
for HCM. Yeah, so it's like an A, B, C, and D staging system, and basically that's degrees of severity. So
D
you know,
being bad.
yeah, and stage A are, for example, the Sphinx cats. As soon as they're born, they're stage A because they're genetically predisposed, but they don't actually have it. And then stage B and above, right, are cats that are affected with HCM. So like when they have a mild HCM without left atrial enlargement, which is one of the things that starts to happen when it gets advanced. When they don't have that, it's stage B1. When they have left atrial enlargement, stage B2. When they have congestive heart failures, is stage C. And then stage D is when they have congestive heart failure that's difficult to manage or refractory to the typical medications. But yeah, we can see on the echo, we can see, is it affecting all of the left ventricle? Is it a mild thickening? Is it a moderate thickening? Is it a severe thickening? So yes, you can have different. It's a spectrum, right? So
Is
you can
there
have.
like so is there like a is there a treatment? Is there a I mean, I suppose if you're scanning and you're a D, it's not good. But I mean, is there what happens? Like, what do you do like at that point? Like, not
Yeah.
to a D, but like B. Let's just say you've done your due diligence, you've had your genetic marker test, everything was fine, but then you came back and it scanned as whatever, a B. Like, so then what? So we've done our genetic marker test. I have a Maine Coon, and then I come in and as a pet owner of a Maine Coon, I should be scanning on a yearly basis, right? Even if any breed that's a poor Maine Coons. Let's stop picking on them. But in general, any cat that's predisposed or it has a higher likelihood should be scanned on a yearly basis. So
Yeah.
which is why I'm hoping this will be our first HCM clinic at a show. But since you
Yeah.
guys are a national brand, unfortunately, I'd love to have you travel around with us, but
Yeah, that'd be awesome.
we have events, and hopefully we'll be able to pop up these HCM clinics. And the idea is for us to make it readily available for everybody to come in and get scanned. But
Yeah.
what to mentally prepare people for? You know what I mean? So if is it absolutely? I ask the question. It's just like, so I have a Maine Coon. He's scanned clear. He came from parents that still scan clear. You know what I mean? But it's not necessarily a death sentence, or is it? Do you know what I mean? Or what? Like, do you know what I mean? Like, because someone could argue, well, I got a Maine Coon. I love how they look. He's huge. He's amazing. His parents are clear. They scan clear every year. He's genetically not, the marker didn't come back as positive. So why should I
Right.
bother scanning him? If he gets GTM,
Yeah.
he's gonna die anyway. Is that,
Yeah, no, I mean, yeah, I
what's
mean, you've got some good things going, right? They've so it sounds like they've been responsible with their yearly echoes and the genetic testing. It's still a good idea, however, if it is
yeah.
a purebred cat that's at risk for developing HCM, it's still a good idea to get him screened yearly with echocardiograms.
So what happens? I guess what happens in different stages. I mean, we don't have to go into super technical medical detail,
Right.
but how panic should do you know? It can't be good for you to be like, you know what I mean? I don't envy
Yeah.
that aspect of your job at all. For
Yeah.
me, I don't. For me, because I'm the craziest cat animal lover in the world. Like I go above and beyond possible to make sure that my cats and my dogs are with me for absolutely as long as possible. Like that's
Yeah.
my job, right? Like that's
Right.
my job for them. So, and I hope that a lot of people that are listening to this, that's also your job, their job. There's no reason. There's no reason why there's going to be that odd thing of whatever something's going to happen. But I mean,
Right.
your job is to take extreme care of your animals, and that's
Yeah.
so what happens, at the different levels, and what's the prognosis ish,
Yeah, so it's very variable. For most mild cases of HCM, most of them stay stable for years. And it tends to be a fairly slowly progressive process, but it's unpredictable, right? Some cats kind of progress quicker than others, right? And each individual cat is different, so that's why we want to monitor them, right? Especially if we see a cat that we see them on echo and has HCM, right? We want to keep an eye on it, right? We want to monitor that over time and see how it progresses. But it's very variable. It could be years, right? So it's not, you don't have. I know it's sad, right, to get a diagnosis of HCM in your pet, right, and you can't help but worry. But I there's no need to panic, right, because it
that's
could
what I
be
want to
stable for years,
But
right?
there's really no cure, right? I mean, like other than what would you do in a human, a heart transplant, right?
Right. So yeah, that's a great question
Yeah.
or great, question. So what nowadays, right? What we do is manage or prevent the complications from happening, which is not great if that's all you can do, right? There's unfortunately no cure for it right now. Um, so, right, if they have left atrial enlargement and they're at risk of blood clots, we start them on Plavix, which is a blood thinner.
Right.
If they develop congestive heart failure, which is in the later stages of HCM, then we can treat that with diuretics, ACE inhibitors, medications to decrease the symptoms, right? To manage the symptom, manage the congestion. But unfortunately, none of those medications modify or cure the condition of HCM. Which brings me to my next point is now, right, there's a new drug that's coming out, and actually CVCA is participating in the clinical trial.
Is this the HALT trial that we're?
Yeah, the
Yeah,
whole
yeah,
trial.
yeah.
Yeah, there's a medication called rapamycin that in some smaller studies, specifically the RapaCap trial,
Mm-hmm.
um, showed a potential benefit in terms of reducing the thickening of the heart muscle. So which is great, right? Because
Which is
there's
huge. Yeah.
yeah, there hasn't been any disease modifying medications, right? Um, so
Ever.
so this could be a potential
It's
potential
like it's
cure
like
if it works.
yeah, it's like FIP in is was a
Yeah,
death sentence,
exactly.
and now it's absolutely not. It's expensive, but
Right.
but it's not a death sentence at all anymore.
Right,
So
exactly.
so
Anymore. It used to be. Yeah.
yeah, but I mean you were done and sorry to fly. So are you guys are you participating in that or is it it's Cornell led? Yeah, you
Yes.
said right. Yeah. All right, and you
So
are
Cornell
participating.
did the initial study,
Yeah.
the RapiCat trial,
Uh-huh.
and as far as the whole trial is a larger nationwide clinical trial that's double blinded, meaning it's how they do human clinical trials for new
Yeah, yeah,
medications.
yeah.
It's
So like one.
placebo controlled.
Yeah, yeah,
Yeah, yeah. So and it's nationwide. So and CVCA is participating. A lot of our offices throughout the United States are participating in this clinical trial, and the point of this is getting you know data, right? Getting data on the effectiveness of this medication. The safe. We already know have an idea on the safety profile, but we will get additional information on the safety, side effects, all those things, um, and see how effective it is truly, right? Because we don't have that data yet. We have some small studies saying that it could be, right? It could be beneficial for HCM. And the name of the drug is rapamycin, or
rapamycin.
or sirolimus
Uh-huh.
is the other name for it. But the brand name is actually coming. The FDA already approved it for treatment even before the clinical trials ended,
Mm-hmm.
based on the results of the initial studies.
Mm-hmm.
The FDA has approved it, and it's actually coming out this summer.
So that's
For
fantastic. No, so if
Yeah, yeah.
you will start prescribing it for cats that come in at any level of this, yeah, and see how it goes.
Yeah, yeah,
Yeah.
yeah.
Yeah,
Depend
of course,
as the
for
clinical trial,
pets. Yeah.
right? As the clinical trial progresses, yeah, and we still encourage people to join in the clinical trial because we still
So
need to
this is
have
not a
that
it's
data.
not a it's not a preventative either, right? Like it's
No,
I mean, so that would be ideal, right? But I mean, like,
right?
but so this is hopefully some good news and a good option,
Yeah,
if there is some, but you still it doesn't stop you from scanning. It's not like, oh, so yeah,
right,
whatever, if he gets it, I'm gonna just put him on a pill, he's gonna be fine. No, I mean
right, right.
not that's
Yeah,
not
we
what.
would start it when we diagnose them with HCM. When they get a diagnosis of HCM, that's when we would prescribe it.
Right, exactly. And I guess just another segue, and this is really maybe not your general area, but insurance, like why it's in
Oh yeah,
why I don't want to. We're not going to plug anybody, but I'm just saying like why
yeah,
it's important to insure your animals. I mean,
yeah.
these treatments can be costly.
Hmm.
In general, in you as a vet in the U.S., like insurance in Europe. I've lived in Europe for 15 years, 16 years now. Pet insurance has been quite a thing over here for a very long time. It's quite newer in
Right.
the United States, but
Hmm.
I mean this kind of stuff that God forbid would happen to your cat, like this would save you. I mean, can save you a lot of money. So it's
Yeah, yeah.
I
Which
do a lot
is
of
which,
stuff about that. Yeah.
Yeah, which is crazy because I feel like veterinary care in the United States has, the costs have increased a lot over time. And I mean, I'm a
It's
bit
all about
advocate.
who has this money, like, in
Yeah,
like side, this could be thousands, if not tens of
yeah,
thousands,
yeah.
in
I mean, an
treating.
echocardiogram down in here in Florida could be 800 to $1,000. So I mean, I'm a big advocate for insurance. I personally have insurance for my own pets, right? Because I'm a vet, right? You would think I could, but there are certain things like I won't do on my pets, right? I'm not gonna do emergency surgery on my
Well,
my own dog, right? So I would have to.
a doctor wouldn't do it to a family member. Let's be honest,
Yeah,
right?
exactly.
So
I
I'm sorry,
I have
a medical
insurance.
doctor. You're still a
You're
doctor.
right, right. So I think it's. I mean, I honestly think it's essential to have, at least pet insurance or have a little fund,
Yeah,
a
and it's
monthly fund for your pets.
it's really pocket change, to be honest. I mean,
Hmm.
you watch the small print. Like, I don't know, some insurances will probably have breed specific things in there, but the things that need to be
Yeah.
things to be watched out for. And and
Hmm.
and, and honestly, like, terrible for you. You know what I mean? As a veterinarian, like, a caring, and, like, I mean, obviously has a lot of empathy. Like, you don't want to be put in that position where the person doesn't have the
Yeah.
money to pay for it. It's a really difficult
Yeah.
decision for a
It is
vet.
always it is
It
always very difficult.
it is really, really difficult. Um, yeah, so I guess this was really good for me, because I don't. I know what specific things, and I obviously know about HCM, but I didn't know about this new medication. So this is really
Yeah.
exciting to talk about. So there is hope on the horizon, I suppose, for HCM.
Yeah.
But at the end of
Yeah.
the day, you need to. You need to I think swabbing your cat in general, in your domestic cat, is essential. To make sure that you can. Because there are things that can be caught. You know what I mean?
Hmm.
On
Hmm.
the, I guess it would be a full panel, right? Like, there are
Right.
things that can be caught.
Right.
You know what I mean, ahead of time. But, as far as your specialty goes, it's there's just not enough information out there in the world about what questions to ask. You know what I mean?
Hmm.
When you want to
Hmm.
add a pedigree, anything to your life. I
Yeah.
laugh. I don't laugh about it, because, like, it's not that means to laugh, but it's like, if you're gonna buy a Maine Coon and they want to deliver it to you in a Walmart parking lot, like, that's a red flag. Do you
Yeah.
know what
Yeah.
I mean? Like, and, like, maybe that doesn't seem weird to a lot of
Yeah.
people, because
Right.
they'll just say, "Oh, I'm heading over to Walmart on so and so. I'll just bring the cat to you." Like, they
Yeah.
do
Yeah.
that
Yeah.
because they don't want you in their property. You know
To
what I
see
mean? Like,
their facilities
do you know
or
what I
lack
mean? And
thereof.
I'm pretty sure that so there are certain red
Yeah.
flags, but if a breeder, if you go to a breeder, and I'm not, and the breeders that come to the shows that we do, or any cat show in general,
Mhm.
generally speaking, are doing the right thing, but we
Yeah.
don't know
Yeah.
it per se. But if they're spending a lot of money entering a show in a hotel and driving and all this kind of stuff, then they're usually
Yeah.
doing their due diligence. But if someone doesn't want to show proof of their tests, that's
Hmm.
you
That's a red
run.
flag. Yeah.
Like, you run, and that's unfortunate, because sometimes you're in the house and you're with the kitten and you're already attached, and they don't show you the test, and then
Yeah.
now what do you do? You know what I mean?
Right. Right. And yeah, I mean that's why it's so important to be educated before you make these important decisions. Of getting getting a cat, right? And especially a purebred cat, right?
Yeah, indeed,
So
indeed.
now, asking the right questions, does the breeder genetically test these cats? If they're, the breeds that are at risk, right? Do they screen them yearly with echoes? Because I've met some breeders that, because I do echo clinics, low cost echo clinics here and there. And, I've met some of them that only did genetic testing, and they thought that was enough, right? And that's not enough, right? It's because even if they're negative for the gene, they can still get it, they can still get HCM. So that's why education, both on the breeder side of things and the client side of things, is so important. And that's why we're on here on this podcast.
Yeah, and
So
hopefully continue. It's and there's other things too, like a breeder. If this is it's a big deal for a breed. Like from when I was breeding cats, I bred Americans and a little bit of Scottish. That's another whole podcast for you,
nah.
which I'm not doing anymore. But the Scottish anyway. But to get a cat from me, even before I was me, you know what I mean, who I am now, you know what I mean. It was like, I mean, you would have to go through like a full-on background check. I mean, I was in your house, your area, like I was looking, and I very rarely misfired. A breeder like that has an amazing amount of care, and like I mean, when my kittens ever left, I was so upset. Those are the breeders that you want. If you decided that you wanted to get a cat or a Maine Coon or a dog or whatever, a pedigree, anything, and there's a puppy or a kitten available, like out on the ready, like to pick up today, red flag. Unless you are just that luckiest person in the world and the cat came back or something fell through, right? I mean, like generally speaking, like there's no way that you're going to be able to pick up a cat. And breeder, even adoptions now these days, they do want you to have a waiting period because they want you to have
make sure it's not an impulsive decision.
Exactly.
Yeah,
exactly. So we decided at the clinic that's going to happen in West Palm, so on November 4th at the South Florida Fairgrounds. This will be our second year there. I'm actually going to be there as well. Hopefully, you're going to be able to do. You're going to be there the entire day, right? For the entire
I'll be there.
Show. And we are going to set up something on our website. We're going to set up something on our web where they can pre-book in advance. Like how many scans can you actually do in an 8-hour period of time?
I can do one in 15 minutes. It depends also on the individual cat, because some cats are more amenable than others, right? But on average 15 minutes. For a scan, so I could do 4 per hour.
At the clinic, you're going to be there offering a low cost alternative at this specific show only, which is going to save quite a bit of money. So we're gonna open this up. Obviously, the attendees or the cats that are entered into the show, they're gonna have first priority. So we would like you, if we do have non-pedigree sections, and if you have a household pet and you want to enter into the show and you also want to get scanned, this would be a really good opportunity for you to do two things, right? To enter the show and also to get scanned. For you guys that are Maine Coon breeders, and I call them the Maine Coon Mafia in Florida, because literally like all of our shows in Florida are like 50% Maine Coons. Like it's kind of funny because of the coat, right? I guess
right.
Air conditioning, right? So everybody that is entered into the show or should be coming to the show, because the savings for this is huge, and let's hope that this works, because this is a really good thing. You have to
it's a good opportunity.
You have to scan annually, right? And this show will happen annually, and then we get it all done. So we are going to have all this on the website page of the West Palm show, and there'll be probably link throughs that'll go to you guys, which you guys will handle the scheduling of the or something else, I guess, right?
Yeah.
It would be great if we could have you do maybe a 15 to 30 minute talk on the stage, which would be good if you have the time. You can
that might be hard.
Well, maybe one of your vet assistants can do it. You know what I mean? Just the. Are you stage? Are you stage?
I'm a little,
I can stay with you.
I try not to.
I can stay with you if you want. Okay, if not, it would be good for us. Maybe someone can do something, or maybe one of your techs can do a little 15-minute presentation on it. I'll obviously talk about it, but 30 cats is a good gauge. So yeah, guys. So there's only going to be 30 slots available. This is kind of our test site, November 1st, West Palm Beach. These guys reached out to me, which was really, really exciting. So I really like that. So hopefully, if all goes well, we are going to be partnering with, oh, you're going to have to cut this.
CBCA.
Yeah. I don't want to. Hopefully, if all goes well, we're going to be partnering with CVCA, nationwide, and hopefully try to also do something similar in the United Kingdom and to our shows in Australia. So I think it's a really important educational piece, and it makes people just need to know, and they just want to know, and they want to do the right thing, and it's so important. And a cardiac veterinarian is not a common thing, I'm assuming.
No, there's only a few.
I mean,
There's only a handful of us in Florida. Yeah.
Yeah, I had one kitten at one point. I'm not breeding anymore. Obviously, I'm a little bit busy. But I was breeding American Shorthairs, which were pretty clear to be fair.
Yeah.
But I had one kitten that had a murmur, and we had to take her to a very. We had to go into Porto. You know what I mean? To go into, because
Right.
it was like the one vet.
One cardiologist. Yeah.
In the entire city of Porto, you know what I mean?
Yeah.
Like we had to schedule in with her. So it's a really specific area of expertise. So it's really great to meet you. I'm looking forward to working
Likewise.
with you. Is there anything else you want to add, or you think we covered everything?
I think we've covered everything. I mean, the echocardiograms are fairly straightforward. We basically
That's something what
the process of it.
what do they expect? So how does it work? I mean, for me, you get the things on your chest, right? Like the wires and stuff. Is not the I would
So the echocardiogram that's an EKG for the little little electrodes they put. That's an EKG, and that's different. That looks at the electrical activity of the heart. The echocardiogram, which is what we're going to be doing, is an ultrasound of the heart. So we're actually looking at the heart,
like the same as
function.
you would use the same thing as like a baby.
Yeah, the gel, the
whole
all of that.
How interesting.
Yeah, so for the cats, and what we'll be doing is, we put them on a nice comfy table on their side, and it takes about 15 minutes for me to, scan the heart, make some measurements.
How
And
cooperative are they? Not, I mean, I bet you. Cats are generally not like very cooperative.
Yeah, so that's the thing to be mindful, because some cats just don't tolerate it, and we're just not able to do it.
Generally, show cats are pretty chilled. You know what I mean?
Right.
For the most part. But
Sometimes
you have to sedate.
I won't be doing that for the show, but sometimes we do need to sedate them. The one thing that owners can consider is their primary care vet may prescribe something called gabapentin, which is a little chill pill for the cats, and then they can give it 2 hours before the show. I don't know they're.
We don't really. If the cat's in the show, we can't.
Yeah, exactly.
If they bring the cat specifically to you, but have other cats in the show, then they know they can't use gabapentin during the show.
Right. Okay. You don't want to have that in your show. So, but for the echo, that's completely acceptable. It won't change any of the measurements or the echo results. So that would be completely fine as well.
So it literally takes 15 minutes for you to fully complete it from start to finish.
Yeah.
And that's when the cat that's fully cooperative.
With a fully compliant cat, yes.
Yeah. So it could be 30 is probably a decent number, and probably at a stretch,
Yeah, I would say so. Yeah.
So I think it's, and then, so anyway, so then is there anything that you can see like right from the get-go, or no? Do you have to are you able to see something like?
It depends on how severe. You mean like from the HCM severity standpoint?
Literally, I'm sitting there, my cat's there, you're scanning, you're watching. I'm assuming you're watching a screen. No, I mean, right?
Yeah. So, I mean, sometimes things are pretty obvious, and I know right away. Yeah. And you just have to be tactful and and all that. But sometimes the changes are subtle, so you don't don't see it right away, so I have to like do my measurements and my assessment
But
on
you'll be able to tell you were able to speak to it like live, as well as give it a report. I mean, you're going to
right,
send a report
right.
anyway, but do you
I
generally
try not to say much before
yeah,
I'm
because
before I
a
send
lot
out a
of
report, because sometimes
yeah,
I'm like sometimes the
you don't want to
changes are
worry
very subtle. Yeah,
for a
yeah,
reason, right? Yeah.
yeah, exactly, exactly.
So the
But if
report,
it's
the report. Yeah. Sorry. Go ahead.
I was just gonna say, but if it's obvious, I know right away.
Yeah, and then we need to progress to a
Right.
different area. So, I mean, I don't know if are you guys at CVCA? Are you generally just cardiac center, or is it also a general veterinarian as well? Is it
Just cardiology.
just cardiology? So it's very
Yeah.
specific.
Hmm.
So you would end up. I mean, to be fair, that's I don't. I mean, is they would be with you if there was a problem anyway, probably.
Yeah, exactly. Yeah, if there's a
You know what I
problem, they
mean?
can certainly
That you would probably
follow
end
up
up
with me.
continue to
Yeah,
follow through. But so
exactly.
it's pretty straightforward. The reports will come to them, the next week, right? Or like
Yeah.
the
W-
you know the,
Typically within 24 hours.
you're gonna stay
Yeah.
up on Saturday night and all
Maybe
this, and
not. Maybe not.
yeah.
Actually, yeah, you're right. Within
Well, by
three to
Monday or
five
Tuesday,
business days.
Monday or Tuesday, maybe. Let's
Yeah,
say
exactly. Yeah.
for the most part. But generally speaking, like you can speak to it minorly, I suppose.
Yeah.
So,
Yeah.
but yeah.
For
So
sure.
this is a really it's a really good thing. I didn't, to be honest, I did not realize how expensive it was in South. Let's be honest, like South Florida
Yeah.
is ridiculous anyway. You know what I mean?
Hmm.
That's all of the East Coast of the United States is very expensive.
Yeah. Yeah.
But this is a severely low cost. I mean, which people that have multiple cats, especially people that are breeding high risk
Yeah.
cats, you know what I mean. They'll benefit from this greatly. So I
Yeah.
appreciate
Yeah.
you guys.
Definitely.
Yeah, so you'll be there. You'll be there all day on Saturday the first.
Hmm.
We'll get up the link on the website, and I would assume that it's going to sell out very quickly as soon as we announce the partnership.
Yeah.
So
Definitely. Yeah. We're here to help, and hopefully we can see a lot of healthy cats.
that's the goal. That's the
Yeah.
goal.
That's
So
the
you
goal.
see some. You see some. I mean, poor Maine. I feel like we picked on the Maine Coons all weekend. I mean, I'll show, but it's in Florida, especially, like I said, like it's literally all Maine Coons. You don't see a lot of British. We see some Bengals.
Hmm.
And some.
I see a lot of Sphinx cats here as
Yeah,
well.
yeah,
Yeah.
we see a lot of
Yeah.
Sphinx. I had two Sphinx a long time ago, but they're a
Wow.
wonderful cat. They're so
Yeah.
they're so people cats. They're more dog like, right? Because they need us. They
Yeah.
can't.
Yeah. Right.
know? So, which is really interesting. So it was really amazing. It was amazing talking to you, guys. For you listening, thank you very much. We are back. This was Dr. Paulo Rivera, who is with CVCA in South Florida, West Palm Beach, who will be with us at the West Palm Beach Cat Stravaganza on November 1st all day. We are going to put up links to sign up on the website, so keep an eye on that. And I look forward to meeting you in person.
Yeah. Definitely. It was great meeting you, and
A
thank you for
more
having me.
yeah.